Recording. Which camera? There we go. Hey, hi everybody. All right, and once I stand up, hopefully it's going to focus a little bit more on me, and the lighting will be a little bit better. Okay, I'm sorry. I'm aware that the light is like not quite right. So in the future, you guys will have the access to the same document that I have. Please let me know if you cannot hear me, okay? And when you have access to the same doc, you'll be able to follow along. But for tonight, I'll just for tonight you won't have access to that. So orientation terms, getting oriented to the body. So most of you, these will be familiar to you. Please touch the areas I'm touching. And without further ado, here we go. So superior and inferior, most of us understand those. Most of these terms are relative, except those that apply to the midline. So the eyes are superior to the nose is superior to the chin, the head, the cranium is superior to the abdomen is inferior to the sternum. Medial and lateral. So medial refers to towards the midline, and lateral refers to away from the midline. Midline cuts between the eyes, down the nose, down the throat, down the sternum, down into the down the belly button and pubic symphysis. So if you're palpating, for example, the fibers of the pectoralis major, and they're telling you, no, the pain is more medial, you would go toward the midline. Or if you start around the midline and they say, no, the pain is more lateral, you would go out away from the midline toward the shoulder. So the shoulder is lateral to the sternum. The sternum is more medial than the shoulder, and there are medial and lateral aspects to the limbs as well. So you have the medial epicondyle of the humerus, and you have the lateral epicondyle of the humerus. For those of you who are still learning your bones, the upper arm and lower arm have 3 different bones. So the upper arm has the humerus, and then the lower arm has the radius, and then the ulna, also called, useful for terms like radial side and ulnar side, right? So you have the medial aspect of the arm, and you have the lateral aspect of the arm. On the back surface, it also would follow the midline. So you have the lateral aspect of the rib cage, or lateral aspect of the lat, and then you have the more medial aspect of the rib cage, or the more medial aspect of the latissimus dorsi. So lateral and medial. You also, for the shoulder blade, you would have the medial border of the shoulder blade, and then you would have the lateral border of the shoulder blade. Okay, let's take a look at the pelvis and legs. So for the pelvis, I'm sorry, I don't always wear like dark colored pants, but for the pelvis, you have the medial aspect and you have the lateral aspect, right? So the ASIS is on the lateral aspect of the ilium, and then compared to the ilium, the ischia, the 2 sit bones of the ischia, are actually more medial than the superior aspects of the ilia. And then you have on the legs, you have the medial muscles and the lateral muscles, medial aspects of the bones and the lateral aspects of the bones. So the vastus medialis is named because that muscle is more medial than the vastus lateralis, which is the more lateral of the 2 muscles. And right between them is the vastus intermedius. Again, you have the lateral aspect of the tibia, the medial aspect of the tibia. You have the superior aspect of the patella, the inferior aspect of the patella. Okay, I think we got it for medial, lateral, superior, inferior. Let's look at distal and proximal. So proximal means towards the center of the body. The center is from like the pelvis through the torso all the way up into like where the neck joins the torso, right? So this is all proximal. So the kneecap, the patella, is distal, and the head of the femur is more proximal. If you were to pick any spot on the IT band, you could use distal and proximal to describe that as well. So towards the kneecap would be the distal aspect of the IT band. More towards the head of the femur would be the proximal aspect of the IT band. In the hands, we see in the hands and the toes, we also see distal and proximal describing the joints. So each digit has 3 joints. It has the distal, which is on the end, and then it has the proximal, which is at the base, and then it has the intermediate, which is in the middle. And these are called the distal phalange and the proximal phalange and the intermediate phalange. I think that may have been a little out of focus, I'm sorry. So anytime you see distal, proximal, medial, and lateral, know that those are all relative, right? So the belly is as proximal as you can get. The femur is distal in regards to the belly. So if you were on the femur and you wanted someone to travel distally, you would go toward the knee and down to the lower leg, upper leg, lower leg. If you wanted them to travel more proximally, you would go towards the torso. So also for those of you learning the bones of the lower leg, you have just like with the arm, you have an upper and a lower aspect to the leg. So upper leg, lower leg, upper arm, lower arm, and then you have 1, 2, 3 bones. So you have the femur in the top, and then as the upper leg, and then the lower leg, you have the tibia in front, which we think of as the shin bone, and then the fibula on the side. Anterior, posterior, ventral, and dorsal. So when we talk about the body, we always use the anatomically neutral position. Anatomically neutral looks like this, right? So it's always facing from the front, right? And it's with the palms facing forward. So this is the anterior surface of my head and face, anterior surface of my torso and abdomen, anterior surface of the legs, and then likewise for the arms, this is the anterior surface of the arm, the forearm, and the hand, all the anterior surface. It can get a little confusing though, because if you look at the hand, for example, the palm is clearly the anterior surface if you're looking at the body from anatomically neutral, right? But if you shift your perspective to the foot, you see something slightly different, right? You would think that maybe the palmar aspect or the soft kind of inside aspect of the foot would be the anterior portion. But in fact, that's not the anterior portion. This is the anterior portion. So how do we distinguish between like the back of the foot being anterior and the front of the palm being anterior? Well, we give them specific names. So you can say palmar for the hand or volar for the hand. You can, and then for the foot, you say plantar for the bottom of the foot and dorsal for the top of the foot or for the anterior portion of the foot. And then meanwhile, that makes it more useful for you to think of the foot in terms of anterior being where the toes are found, and then posterior being where the heel or where the calcaneus is found. Yeah, so volar is a special term for the hand, palmar is a special term for the hand, and then plantar is a special term, dorsal and plantar is a special term for the foot. Dorsal is a term that we have for the rest of the body as well. So this is the dorsal aspect of the leg, the hamstrings and the calves are on the dorsal aspect of the leg. And this is the volar or the anterior aspect of the leg. So I'm sorry, not volar. This is the anterior or the ventral, anterior or ventral portion. So anterior and ventral are the same. And then posterior and dorsal are the same. And special terms are volar for the hand, plantar for the bottom of the foot, dorsum for the back of the foot. Okay, so that's all the orientation terms. So we did anterior, posterior, ventral, dorsal. We did special terms, volar and plantar. We also did superior, inferior, medial and lateral, distal and proximal. And then we did Yeah, and that's everything. Oh, okay. Let's go over some joint movements and then we'll look at planes. So the most common ones are flexion and extension and abduction and abduction. When I say most common, I mean like those are the ones that at least I understand as fairly intuitive for how the body's put together, and then as a result, how it moves. So if we're looking at the body from the front, if this is anatomically neutral, looking at it this way, then it should be pretty intuitive to you that this movement of the spine, this movement of the cervical spine, is closing the front aspect of the body. Therefore, it's called flexion. So this is bringing the bones together because we're looking at the front aspect of the body. If we were looking at it from the back, these bones would be coming apart, but they're not. They're coming together because we're looking at it from the front. The front is anatomically neutral. Their starting point. So this is flexing the cervical vertebrae, and this is extending the cervical vertebrae. So the cervical vertebrae right now are going like this. They're moving away from each other, and they're going like this in flexion, moving towards each other. Hopefully that makes sense to you right away. So this is flexion, this is extension of the neck, and then for the rest of the spine, this is flexion of the thoracic and the lumbar spine, and this is extension of the thoracic and the lumbar spine. For the shoulder, therefore, if we're looking at the body from the front, this would be flexion, shoulder flexion. This is neutral, and this is extension. So this is flexion. This is neutral, and this is extension. So I'm in extension moving toward flexion. Now I'm in flexion, and I'm in flexion moving toward extension. Likewise for the hip, I want to make it easy on myself to lower this thing down a little bit. What a great idea. So for the hip, flexion is this way, and extension is this way. So I'm taking the leg back behind me for extension and taking the leg forward for flexion. And then for the knee, it's different direction. So flexion takes the foot behind the knee. Extension straightens the leg or brings the foot in front of the knee. Flexion and extension. And then for the foot, we have special terms. We have plantar flexion, because this is moving in the direction of the plantar surface of the foot. And we have dorsal flexion. This is moving in the direction of the dorsal surface of the foot. Plantar flexion and dorsal flexion. And for the wrist, for the hand, it's just flexion and extension, right? So again, looking at it from anatomically neutral, wrist flexion, wrist extension. So likewise, the muscles in the forearm are called the wrist extensors and then the wrist flexors. Oh, by the way, also flexion of the elbow, extension of the elbow, flexion of the fingers, extension of the fingers. Okay, what else do we need to do? So that's flexion and extension. Now, abduction and adduction. So abduction is abducting or taking away from the midline. Adduction is adding or bringing toward the midline. Remember, we're starting from anatomically neutral. So if we're starting here to go toward the midline to adduct, we would move this way. Don't get confused thinking that, okay, I'm moving through abduction. And then when I get to, oh, I don't know, I'll just make it up like about here. If I go towards the crown of the head, that actually is adduction. No, it's not adding this way. That's just the end range of motion for abduction. So this is abducting, and now I'm moving back towards adduction. Adduction, abduction, adduction, right? We don't abduct and adduct the head because that one stays on the center line. It stays like attached to the center line the whole time, right? So instead, that's side flexion or lateral flexion. The hip, however, the hip and leg, we do abduct and adduct those. So this is abduction and this is adduction. So anytime you bring the knees towards each other, if you, even lower, anytime you need to bring the knees towards each other, like if you give the instruction to squeeze the knees together, that is adducting, and to press the knees apart, that's abducting. That's abduction. And the movement is a little bit more strict than what I'm showing. The foot, if the foot can move, it makes it much more clear for abducting and adducting. Sometimes the foot stays on the ground and then the knee appears to move, but it's actually rotating outward. And that's a different movement that's called external rotation or lateral rotation. In fact, let me show you that now. So external and internal rotation, they happen as a result of the movement through the hip joint. And all these rotation movements that happen through the hip and through the shoulder joint are best understood with the extended limbs in different positions. So if you start straight and you rotate the foot and the knee out, that's obviously external rotation, right? You should look at the femur, the upper bone always, the femur on the leg and the humerus on the arm. So this is rotating outward, right? And this is rotating inward, right? So this is lateral rotation or external rotation, same thing. Medial rotation or internal rotation, same thing. And with the knee extended, the foot and the knee act as pointers. You don't have to go like this with your fingers. Although on the test, when you're taking the test, you definitely should be doing this. You should be like, I want you to be like the strange student in the room who's like moving in weird ways, right? But you definitely should do this to make it clear. Look at the femur. The femur is rotating in. Now the femur is rotating out. If I bend my knee and change positions a little bit, still the femur is rotating inward. And now the femur is rotating outward. You still have the knee to point more or less in, and you have the knee to point more or less out, and even the foot will point in and out. But what if you do this? What if you put the foot back behind you? Now the knee and the foot are pointing opposite directions. So my knee is pointing out, that's lateral or external rotation. Now my knee is pointing in, that's medial or internal rotation. Let me just bring that up a little bit so you can get a little bit different view, right? So with the foot hovering off the floor, keeping my hand here so you can see my knee. You can see that the knee and the foot are moving in opposite directions. This is external rotation. Look at the movement of the humerus, external rotation. And this is internal rotation, internal rotation. Again, if I straighten, the foot moves in the same direction as the knee. If I flex the knee, the foot moves in the opposite direction, right? You have to look at the movement of the humerus, which way is the movement of the femur, which way is the femur moving. Internal and external rotation, medial and lateral rotation. And now the shoulder. So with the shoulder, again, if you look at like the thumb or the elbow, you can see, if you look at the thumb, you can see that rotating the shoulder is very clearly external or internal, right? But you have to look at this bone. You have to think about the humerus, right? So now the humerus is rotating externally. That's external or lateral rotation. And now the humerus is rotating medially. That's internal or medial rotation. External and internal. You should be saying these terms and moving. So external and then internal. Lateral rotation and medial rotation. So we've got our arms kind of up like this. Now let's bring them down by our side. And now do those movements. So external rotation and then internal rotation. Again, lateral rotation and then medial rotation. And now bend your elbows like this. Let's go like this. So now to externally rotate, it would look like this. And to internally rotate would look like that, right? External rotation, and then internal rotation, medial rotation, and then lateral rotation. Let's get a position that's going to be a little bit more likely they'll ask you. So keep your elbow by your side and then place your hand out, place your forearm at about 90 degrees, right? So think about the rotation, think about the movement of the humerus. Externally rotating the humerus looks like this, and then internally rotating the humerus looks like this, like bringing the hand toward the belly. External rotation of the humerus, internal rotation of the humerus. External rotation or lateral rotation, lateral rotation, medial rotation. What if you bring the arm up like this? This is called the goalpost or the W position or goalpost position. Now, external rotation looks like that, and medial rotation looks like this. Again, look at your humerus and look at the way the arm bone is spinning. It's going externally or back this way. So external or lateral, internal or medial. One last time, and that's with the arms straight out. So now you're in kind of a Y position. And with this one, you can look at the hand, but definitely pay attention to the humerus. So my thumb is spinning back as my humerus is spinning back. That is lateral rotation. Now, as my humerus spins forward, the thumb spins forward. That's internal rotation, lateral rotation, and medial rotation. So we're going to go over those every class in the beginning of the class. Let's continue with protraction, retraction. So I'm going to take my shirt off so you guys can see my shoulder blades. And this is like really the only time that I will do this in class because it's just too cumbersome to like go back and forth and all that. But for the shoulder blades, you will have to know these movements for sure. So for the shoulder blades, you have elevation, neutral, and then you have depression, right? So you have elevation of the shoulder blades going up, the upper traps contract, and you have depression of the shoulder blades going down, and the lats contract, right? And then you have shoulder blades coming together, that's retraction, and the shoulder blades coming apart, that's protraction. So you can think of protraction as hollowing the chest, as rounding the back, and you can think of retraction as lifting the chest and bringing the back together. If you put your hands out like in a push-up or a plank position, it becomes a little bit more intuitive. So pushing forward results in protraction, pushing forward results in protraction, squeezing together results in retraction, right? Protraction forward, retraction back, elevation up, and depression down. And then, what else do we have? Elevation, internal, inversion and eversion. Okay, we'll go over inversion, eversion in a minute because those are in the foot. Internal, external, dorsiflexion, plantar flexion, also in the foot. Wrist, radial deviation, and ulnar deviation. So if we look at the body as from the anatomical position, this needs to come down now. If we look at the body from the anatomical position, with the palms facing forward, there's a medial side and there's a lateral side, right? So that means there's a side towards which we can add or adduct, and a side towards which we can abduct. So this is adduction, abduction. But we have special terms for those. We also call them ulnar deviation because the ulna bone is over here, and radial deviation because the radial bone is over here. So radial deviation, please move and repeat after me. Radial deviation, and then ulnar deviation. Radial deviation is the same as abducting. Ulnar deviation is the same as adducting. And that's because we're looking at the body from anatomically neutral, right? If I change positions, if I go like this, radial deviation becomes abducting and ulnar deviation becomes abducting, right? Which is ulnar is supposed to be adducting. But anyway, okay, so that's the wrist, radial, and ulnar deviation. And while you can see, while you can see the shoulder, I want to finish up with the shoulder movements. So we had flexion and extension, and then we have abduction and adduction. We also have a horizontal movement, which is called horizontal abduction and horizontal adduction. So I'm horizontally adding to the midline. Here's my midline. Horizontally taking away from the midline, abducting away from the midline, right? And there's also, did I say horizontal? Yeah, horizontal abduction, horizontal adduction, and then there's diagonal. So diagonal abduction, diagonal adduction. Here's the midline. So I'm adding horizontally and I'm taking away horizontally. I'm adding horizontally toward the midline, and then I'm taking away horizontally away from the midline. So horizontal adduction, horizontal diagonal abduction, diagonal abduction, horizontal adduction, horizontal abduction. And then there's another joint movement, which involves the tip of the extremity moving in a larger circle than the base of the extremity, and that's called circumduction. So it looks like this, right? So this involves both adduction and abduction. It involves some extension and some flexion, right? Extension, flexion, right? So it's drawing a circle among those 4 points, right? And sometimes there's also some rotation, some internal, external rotation. So sometimes they will rotate like this, right? And it can involve, therefore, all the movements. And you can have circumduction at the shoulder, you can have circumduction at the wrist, you can have circumduction at the neck, or anywhere along the spine that you have free movement. You can have circumduction through the hip joint between the pelvis and the femur, and you can have circumduction through the lower limb at the hip joint, movements happening at the hip joint. You also can have circumduction through the circumduction through the ankle joint, right? Okay, that's circumduction. Now let's look at some movements of the foot. Foot-leo. Foot. All right. So for the foot, our special terms are plantar flexion and dorsiflexion, right? So plantar flexion and dorsiflexion. And there's also, for the foot, so you know, there's also adduction. Here's the midline, right? Between my feet, there's adduction, and here's abduction, right? Abduction could also look like this. Adduction could look like that. Abduction could look like this. If we move just through the ankle, it'd be like this, something like that, right? Coming toward the midline, going away from the midline. Abduction, adduction. There's also, let's see, we did flexion, plantar flexion, dorsiflexion, abduction, adduction. There's also supination and then pronation. Oh, we didn't cover supination, pronation in the hand. We'll get to that. All right, this is supination. For supination of the foot, I want you to think of the plantar surface of the foot. I want you to think of the plantar surface of the foot coming to face up. That's the direction it's moving. And with pronation, I want you to think of the plantar surface of the foot going deeper down into the ground, or the bottom of the big toe going deeper down into the ground, right? So, and there's not very much movement to be had there with pronation. Or you can just think of the foot as facing down for pronation. Prone to spill it. Carrying a bowl of soup and then prone to spill it. For the hand, carrying a bowl of soup and then prone to spill it. Carrying, supine, prone to spilling, prone. So then there's a movement called inversion and eversion for the ankle. So inversion looks like this, and eversion looks like that. And if I get back far enough, maybe you can see my knee, or close far enough, you may be able to see my knee. Here's my knee right here, right? So this is inversion of the ankle, and this is eversion of the ankle. So this is eversion and this is inversion. So when you invert, you're also supinating a little bit, because if I continue the movement, I would be moving towards supination. So inversion involves supination. It involves some adduction toward the midline, and it also involves a little bit of plantar flexion. So plantar flexion, plantar flexion, plantar flexion, adduction, and supination. And there you have inversion. Plantar flexion, adduction, and supination. And there you have inversion of the foot. Eversion goes the other way, which involves dorsiflexion, followed by pronation, followed by abduction. Dorsiflexion, pronation, abduction, eversion. inversion. Okay, let me take a look at my turns and make sure that we covered everything. Inversion, medial, lateral, internal, external, dorsiflexion, plantar flexion, dorsiflexion, plantar flexion. Lateral flexion of the neck and spine, horizontal, abduction, diagonal, circumduction. Yep. Sound enough. That's everything. Okay, planes. Let's do the planes while we're down here. So right now we have a foot and a knee showing. If I flex the foot, I'm moving the leg back. If I extend, I'm moving it forward. So forward and back. This is the sagittal plane, flexion and extension of the knee, plantar flexion and dorsiflexion of the foot, plantar flexion and dorsiflexion of the foot. If I abduct and adduct, or if I abduct and adduct through the ankle, those are happening through the frontal or the coronal plane, the frontal or the coronal plane. It'll make a little bit more sense to you when I raise the camera up and you see it in the context of the rest of the body. And I never bothered doing any of this stuff until pandemic, you know what I mean? So flexion, hip joint first, sorry. So flexion of the hip joint, extension of the hip joint, right? That's all happening within the sagittal plane. Flexion of the hip joint, extension of the hip joint. Flexion of the shoulder, extension of the shoulder. That's sagittal movement. That's all sagittal plane, right? And then abduction of the hip joint, adduction of the hip joint. Those are happening. Also abduction of the shoulder, abduction of the shoulder. Those are happening through the frontal or coronal plane. I think about the frontal or coronal plane. If you can remember frontal and coronal, you kind of got it made, because if you can remember that this is the frontal plane, you end up at the corona of the head. If you keep going through abduction, that's how I remember it. And then also side flexion or lateral flexion through the neck, side flexion or lateral flexion through the spine. Those are also in the frontal plane. Flexion of the head and neck are in the sagittal plane. Flexion of the spine, extension of the spine are in the sagittal plane. And then that's also called the longitudinal plane. Flexion and extension of the elbow, flexion and extension of the palm when you're in anatomical position would be happening through the sagittal plane. And then horizontal transverse movements. So horizontal adduction, horizontal abduction would be happening through the horizontal or the transverse plane. This is also called cross flexion, by the way. I don't know if this is called cross extension. I've never seen it written like that, but I have seen this. They say in some types of therapy books, they say have the patient cross flex their arm, right, as a way to try to test their range of motion, for example. So cross flexion or cross adduction is horizontal plane movement. Rotation of the neck is horizontal or transverse plane movement. Rotation through the spine, rotation through the hips is also horizontal or transverse movement. And then I think that's it. I think we covered all the planes. We got to practice these planes on a regular basis. Make sure that you practice your planes, your joint movement basics, some of your joint movement basics every day, and make sure that you do your orientation terms every day. Because if they say, like, you know, distal and medial, or proximal, if they say proximal and distal, see, I just mixed up my terms, right? I mixed up medial, lateral, which is one set, and proximal, distal, which is another set. If you mix your terms up like that, or if you forget which direction is which, you are hosed for that question, and maybe for many, because a lot of those questions are built on orientation terms. So that's it for my kinesthetic portion. So let me switch cameras. Great, and we're going to go back to a screen share, and then we'll finish up a couple more minutes. We'll look at the rest of the rest of the joints. Oh, I was supposed to do that previously, and I didn't do that. I'm sorry, guys. So start share. Go, start recording, and so now we're going to go down to to this chart here, right? So we covered synarthrodial, amphiarthrodial, and now we're going to cover diarthrodial. And remember that synarthrodial has almost no movement. Those are fibrous, those are fibrous or fixed joints, Amphiarthrodial or amphiarthroses, they have slightly movable joints. Those are cartilaginous joints. Now the diarthroses, we just moved all the diarthroses. All this movement we were doing was through joints of diarthrotic nature. Those are through diarthrosis joints. So also called synovial. So synovial joints, let me get a nice definition of synovial joints. So synovial joints are those which are lined with synovial cells, and the synovial cells, they produce the synovial fluid. The synovial fluid, or the synovia, is a viscous fluid that helps to lubricate the joints. Typically, it's a little bit whitish, and viscous means kind of like a gel or an oil or sticky. It moves more slowly. It flows more slowly than liquid. Synovial joints, diarthrotic joints. All diarthrotic joints are lined with synovial tissue. Synovial, I think I've heard it referred to as synovial cartilage, synovial cells, synovial fluid. Okay, there's 6 types of synovial joints, 6 types of diarthrotic joints. Those are all listed right here. Instead of like going through them like that, I would love to show you the joints. Here's the link, by the way, at Physio-Pedia for where I got this chart. And then why did I put there? Okay, whatever. So types of joints include an axial joint. Let me see. Let me get the a pivot joint. Number 1, pivot joint. And picture number 1. Okay, good job, Ken. Pivot joint. So a pivot joint has a central axis, and everything turns around that axis. So here, the vertebrae and the skull are turning around the axis. Vertebrae and the skull are turning around the axis. Another pivot joint is located at the radius. Yeah, it's located at the radius, which is the lateral side. That allows the radius to turn around a central axis. The bone itself, the radius, is the central axis. A hinge joint. Hinge joints allow for, they say it's one type of movement. It's really movement in one plane. It's flexion and extension. So a hinge joint looks like this. And examples of hinge joints are the elbow and then the knee joint. They allow for flexion and extension. Saddle joints are only found in the thumb. They're not showing it here. Oh yeah, here's a saddle joint right here. Unique to the saddle joint is that it has a convex surface and a concave surface on bone number 1, as well as a convex surface and a concave surface on bone number 2. We'll go over those again. And I have seen that as at least as a practice question. Plane joints allow movement in at least 4 directions. The ankle is both a hinge joint in plantar flexion, dorsiflexion, and a plane joint that allows for abduction, adduction, as well as plantar, because it allows for plantar flexion, dorsiflexion, adduction, and the bones themselves can actually move a little bit, sliding past each other. The bones of the vertebrae are also like that. They can move in like 6 directions, the vertebrae, if you include rotation. Ball and socket joint. There are 3 ball and socket joints in the body. The first 2 are very obvious, and the third is not so obvious. So the first one is the hip joint and the shoulder joint. The first 2 are the hip and shoulder. The hip joint has a deep socket and a big ball and a small ball, deep socket and a big ball that fits deeply. The shoulder has a shallow socket and a big ball that fits shallowly. And then the third type of ball and socket type joint is actually called a condyloid joint. So you have 2 ball and socket joints, and you have a condyloid joint, which is a ball and socket concept joint. You have multiple bones in the wrist that form a kind of an arc, and the arc is met by a concave arc of the radius and the ulna. We'll go over this again, a condyloid joint. The wrist is a condyloid joint. And that is it. We are over time. I appreciate your patience. I will text you the link for the recording when it's up on YouTube. In the meantime, if you have any questions, if you have any concerns, if there's anything that you want me to know, please text me. I do not respond to email. So please send me a text message using the text thread, or if it's private,